Hi everyone, today is the second part of the series in diseases of overnutrition and undernutrition. So today we're having a look at undernutrition and how this affects food choices. So here's your definition for undernutrition. Undernutrition occurs when people don't consume enough kilojoules or a particular nutrient such as vitamins and minerals. And it might develop because they don't know how to prepare, or they can't obtain their food. They have trouble absorbing food due to some other disorder, or they have an increased need for kilojoules. So today we're going to focus on anemia, osteoporosis, and eating disorders. The first disorder of undernutrition we're looking at is anemia. So it's a blood disorder which is caused by not having enough hemoglobin or red blood cells. So you can have a look just in the picture there. In a normal person, the amount of red blood cells is on the left, so there's quite a few, but in an anemic person, the amount of red blood cells is actually quite reduced. So you need to have a regular intake of iron, because iron actually forms hemoglobin in red blood cells. So that's what makes your blood cells red, is that heme part. Hemoglobin actually combines them with oxygen and carries it to all parts of the body where it's released for energy. So if you have a look at the picture, what we have are the symptoms of anemia. So most of your symptoms relating to anemia relate to the fact that your body isn't transporting enough oxygen around the body. So you are tired and you don't have enough breath and your skin is really pale. So if you see anyone with these symptoms, people who are really pale, the first thing people think about is not having enough iron. So have a look at the picture. There's lots of different symptoms, but if we're moving around, fatigue, dizziness, and then all things to do with the heart, like low blood pressure, palpitations. It can lead to chest pain, angina, spleen enlargement. So the spleen is where all your red blood cells go to die. Muscular weakness, shortness of breath, and that paleness. So iron's required for a number of key things in the body. It's transporting oxygen around the blood and into the muscles, controlling the release of energy from cells, producing red blood cells, and making sure you've got a healthy immune system. People who are at risk of developing anemia: vegetarians for the obvious reason that they're not consuming iron, teenage girls, and that's due to menstruation and that loss of blood, women for a similar reason, and people who've had any major surgeries for the same reason, for blood loss. If you have a look at this diagram here, this is from the Australian Health Survey, and it shows you people who are at risk of developing anemia. Down the bottom you have your age groups, and so you'll notice that that risk of anemia actually spikes when you're older, and that's probably due to older people not eating a lot of meat because their digestion's a little bit low, not being able to absorb their nutrients as well, so a bit of an impaired digestive function. You'll also see that women, 25 to 44 are at a higher risk as well, and that's probably due to, menstruation, pregnancy, childbirth as well. So we all hear that iron, the best sources are from red meat. Iron absorption from meat is about 15, so you get about 15 to 18% out of it. And that's because it contains heme iron. Heme iron is also in seafood and poultry, so animal sources. Iron absorption from foods that contain non-heme iron is actually much lower, so you're only getting about 5% of the iron, and they're all plant foods like cereals, vegetables, legumes, and nuts. You can actually improve that amount of non-heme iron that's being absorbed by having foods that contain vitamin C with it. So capsicum is a good example. Some people who are having trouble absorbing iron actually take vitamin C supplements when they're eating their iron sources, just to increase that. The next disease of undernutrition that we're having a look at is osteoporosis, and it occurs when your bones lose minerals like calcium, and that's losing them more quickly than your body can actually replace them. So have a look at the picture there. You've got a picture of the normal bone matrix, which looks like a sponge, and then in osteoporosis those holes actually get much bigger, so your bones become thinner, less dense, and then you've got more chance of getting a fracture. So make sure now that you actually write down your definition of osteoporosis. There are some risk factors that actually make you more likely to get osteoporosis. So women actually are at more risk of getting osteoporosis because of decreasing estrogen levels during menopause, and they lose a lot of bone density then. Anyone who doesn't have enough calcium or vitamin D, some other medical conditions, smoking, excessive alcohol actually draw calcium from your bones and make them more brittle. A lack of physical exercise, and then the fact if you're over or underweight. So we've got over 1 million people in Australia with osteoporosis. So diet is really important for preventing osteoporosis and for the treatment of osteoporosis. It's really important. Your bones are actually growing in density up to probably the age of 25. So it's important for everyone, especially girls now, to be making sure you're consuming enough calcium and that you're participating in exercise so that you get your bones become as dense as they can before you start losing bone mass, which happens after the age of 25. So calcium foods are sort of your most obvious things that contain the highest source of calcium, but also you have fish with bones, green leafy vegetables and almonds. Have a look at the table on the right and it shows you the amounts of calcium, which is measured in milligrams. It's a mineral. So you'll see milk, just a cup of milk, 315 milligrams, but then sardines, just having a half a can of salmon with bones, 250 milligrams. Almonds are also really high, so anyone who didn't like dairy or wasn't a fish fan, almonds are also really good. Dried beans, any of your green leafy vegetables, including bok choy and broccoli, are also have amounts. Vitamin D, which you get from sunlight and oily fish, also help with calcium absorption, and then exercise. So have a look at the table there, showing you how, like, the best exercise for increasing your bone density. So that word osteogenic is building of bones. So you'll see the best exercises are on your left there: basketball, netball, impact aerobics, tennis, jump rope, and then running and jogging. Your low bone building exercises are walking, warm bowls, yoga, and then things that don't help to build bone really are swimming and cycling. And the reason for that is that you're not weight bearing during those things. So it's the weight bearing exercise that actually helps you to build bone density. So that's why they say as you get older you should still be doing some kind of weights so that you are working on your bone density. This table shows you the recommended amounts of calcium that people should have each day depending on what stage of their life that they're at. So children between 500 milligrams and 1300 milligrams. So you'll notice there as teenagers that increases. During adult, it's more of a maintenance dose at 1000 milligrams per day, and then as people get older they're still at that 1300 milligrams per day, which is what teenagers are at as well. So that's really important just to have a look at. If you couldn't get your calcium from food and you didn't eat a lot of foods high in calcium, then taking supplements is actually what you have to do. Vitamin D plays a huge role in the absorption of calcium. It promotes it in the gut and helps to maintain good calcium and phosphate concentrations in the blood. Vitamin D is also really important for bone growth and to remodel the bone. So when you don't have enough vitamin D, bones become thin and brittle. And in children, there's a disease called rickets, which used to be really common. So have a look at the picture there. You'll see that some signs of rickets are that soft spot on the baby's head, which all babies are born with, but when that doesn't close up, that can show rickets. Curvy bones, lumpy joints, all that bowed-leggedness as well. So some things that lead to rickets are not enough exposure to sunlight, poor skin colour, lack of vitamin D, mothers who have vitamin D deficiency, or any disorders of that will impair your digestion. It's important to note that skin colour, people with darker skin actually absorb less vitamin D, so the sunlight actually doesn't help cultures who have dark skin as much as what it helps people with lighter skin. So we know that vitamin D comes from sunshine, but have a look at this table here and it shows you skin type, the season, and recommended time of day and how long you need to be in the sun for. So for Australians who are mostly moderately fair, during winter, which is now, if you're just having your arms exposed recommended time of day is midday, obviously when the sun's up in the highest, and that you should be out in the sun for 7 to 30 minutes. But if you have darker skin, that actually has to be quite higher and going up to 3 hours. Whereas in summer, you'll see the amounts are actually quite reduced, whereas you should just be out in the mid-morning or mid-afternoon when the sun is at its, the UV rays are less, and it's only 5 to 10 minutes you need to spend in the sun to get your vitamin D. Apart from sunlight, not a lot of foods contain vitamin D, but all of your fatty fish liver oil like cod liver, cheeses and egg yolks, so those fatty foods contain your vitamin D. So you might want to just pause now, and if you haven't written down your summaries for anemia and osteoporosis, it'll be best to do that now before we move on to eating disorders. Okay, here's a little summary of eating disorders in Australia, and you'll see that they can occur in people as young as 7 or as old as 70. So mostly we just think about young women as being people who suffer from eating disorders, but it actually can occur between 7 and 70, and it's male and female. The cost of eating disorders in Australia, $69 billion. So those costs relate back to hospitalisations, sicknesses that occur after that, or any treatment plans. So 69.7 billion is quite a lot of money. Risk factors for eating disorders, you've got dieting, negative body image, it can be genetic as well, and psychological traits, which we'll talk about in a minute. Eating disorders are also really commonly associated with other mental disorders such as depression, anxiety, substance abuse, and personality disorders. The latest figures are that it affects about 9% of the population. So, 9 out of every 10 people are suffering some sort of eating disorder. Two most common eating disorders are anorexia and bulimia. So this is sort of generalized. Anorexia, you've got low body weight, concern with body image, some kind of obsession about gaining weight, food deprivation where you're not having enough food, and increased levels of exercise can also occur with anorexia. On the other side of things, bulimia is more about recurrent binge eating where you have a sense of a loss of control, and then you follow that up with guilt and shame, which then manifests in vomiting, laxatives, or over-exercising to try and get rid of that food that you've consumed. In bulimia, the person actually usually maintains an average weight or slightly lower, so it's not always detectable as what anorexia is. There's a really great website, an Australian website called eatingdisorders.org.au, so I've put the link down there for you. That's a good one to go on. It has lots of different information about eating disorders. So just some statistics about eating disorders in Australia. 1 in 100 adolescent girls develop anorexia nervosa. So if you're having to think about the girls that you know, 1 in 100 of those will actually have some kind of anorexia, whereas 1 in 10 adults and 25% of children are actually male with anorexia. Interestingly, the onset normally occurs during adolescence, with this median age of 17, and the people who develop anorexia normally have it for around 7 years, and even if they recover, they're unlikely to actually recover back to normal health, which is really sad. Bulimia, 5 people in 100, but they only really detect 10%, so those statistics are a bit of a guess. Bulimia normally occurs later on in life, between 16 to 18 years. And like anorexia too, they can keep their disorder hidden, but probably more so with bulimia because they're still maintaining an average weight. And just some statistics there, 83% of bulimic patients vomit, 33% use laxatives, or 10% take diet pills, and that's to get rid of the food that they have consumed. So please use the links that have been provided within the presentation, particularly the ones on eating disorders. There's 2 links there that are really good for showing you different information, different statistics, and where to go to for help if you need it. There's a really good page about risk factors as well, which you might want to read to help you to see if any of your friends have the risk factors for developing those eating disorders. Okay, that's it for our presentation on undernutrition today. Hopefully you've answered all the questions on your Word document that was associated with this, and I'll see you in class for some more activities related to this topic.